Hello and welcome to our channel. Did you know malaria affects millions of people worldwide every year? You heard that right. This disease, despite being preventable and treatable, continues to impact global health significantly. So, what exactly is malaria? It's a life-threatening disease caused by parasites that are transmitted to people through the bites of infected female Anopheles mosquitoes. It's not something you catch from casual contact with someone else, but rather from a tiny insect with a deadly payload. There are several types of malaria, each caused by a different species of Plasmodium. The most severe forms are caused by Plasmodium falciparum and Plasmodium vivax. These parasites are tricky. They have a complex life cycle and are masters of evasion, making the fight against malaria a challenging one. The impact of malaria on global health is substantial. According to the World Health Organization, there were an estimated 229 million cases of malaria worldwide in 2020, leading to approximately 410,000 deaths. The majority of these occurred in sub-Saharan Africa, and children under 5 were the most vulnerable group affected. But it's not all doom and gloom. In the last 2 decades, we've made significant strides in the fight against malaria. The invention of rapid diagnostic tests, the wide distribution of insecticide-treated bed nets, and the development of effective anti-malarial drugs have all contributed to a considerable reduction in malaria cases and deaths. However, there's still a lot of work to be done. Malaria remains a major public health issue, especially in low-income countries where resources for prevention and treatment are limited. Malaria is a complex disease, but understanding it is the first step towards defeating it. In the upcoming segments, we'll be discussing the causes, symptoms, diagnosis, and treatment of malaria in more detail. So, stay tuned as we delve deeper into this significant global health issue. Stay tuned as we delve deeper into the causes, symptoms, diagnosis, and treatment of malaria. And so, what exactly causes malaria? Malaria is a complex disease, but the primary culprit is a tiny parasite known as Plasmodium. It's not one but 5 species of these parasites that can cause malaria in humans. The most deadly of these is Plasmodium falciparum, but Plasmodium vivax, Plasmodium ovale, Plasmodium malaria, and Plasmodium knowlesi also play their part in spreading this disease. Now, these parasites can't just jump into humans on their own. They need a vehicle, a mode of transport, and that's where mosquitoes come into play. The female Anopheles mosquito is the primary transmitter or vector of malaria. It's not that they are born with these parasites. The cycle begins when a mosquito bites an infected person and ingests the malaria parasites present in that person's blood. As these parasites mature and reproduce inside the mosquito, they reach a stage where they're ready to infect a new host. When the mosquito takes its next blood meal, it injects these parasites into the unsuspecting victim. From there, the parasites travel to the liver, where they mature and multiply. When they're ready, they burst out of the liver cells and invade the red blood cells in the bloodstream. This is when the symptoms of malaria start to appear. It's a sneaky and efficient process, isn't it? And it's also why malaria is so prevalent in tropical and subtropical regions, where mosquitoes thrive due to warm and humid conditions. But remember, not all mosquitoes carry the malaria parasite. It's specifically the female Anopheles mosquitoes that are the carriers. And not all Anopheles mosquitoes are infected. Anopheles mosquitoes become carriers only when they bite a person already infected with malaria. It's a cycle that's been going on for thousands of years. But understanding this cycle is the first step in breaking it and reducing the impact of this deadly disease. Now that we know the cause, let's look at the symptoms. How do you know if you've contracted malaria? A question that has puzzled many, as the symptoms of malaria can be quite similar to other illnesses, especially in the early stages. Let's unravel this mystery together. Malaria typically manifests itself through an array of symptoms that start showing up 10 to 15 days post the mosquito bite. The first signs are often flu-like symptoms, including a fever, headache, and chills. These might seem common and harmless, but if you've recently been in a region where malaria is prevalent, these could be early warning signs. As the disease progresses, you might start experiencing more severe symptoms. These include profuse sweating, body aches, and nausea, which may lead to vomiting. Some people might also experience diarrhea. As the parasite starts to affect your red blood cells, you might feel fatigued due to anemia. In severe cases, malaria can cause jaundice, which is a yellowing of the skin and eyes due to liver damage. But malaria is a tricky beast. Not all malaria parasites are the same. There are 5 different types of Plasmodium parasites that can cause malaria in humans. The most severe form is caused by Plasmodium falciparum, which can lead to life-threatening complications such as cerebral malaria. This is a severe neurological complication where the brain gets swollen, leading to seizures, mental confusion, and even coma. Another variation of malaria, caused by Plasmodium vivax, often presents with recurring symptoms. This is because the parasite can remain dormant in the liver and cause relapses months or even years after the initial infection. Knowing the symptoms is half the battle won. If you or someone around you is experiencing these symptoms, especially after traveling to a malaria endemic region, it's imperative to seek medical attention immediately. Early diagnosis and treatment can significantly reduce the severity of the disease and prevent complications. If these symptoms sound familiar, it's crucial to get a diagnosis. Remember, malaria is not just a disease. It's a global health challenge that we can overcome together by staying informed, vigilant, and proactive. How can malaria be diagnosed? That's a question we often hear, and the answer is through a simple blood test. When a doctor suspects malaria, they'll order a blood test to confirm the suspicion. The test is designed to detect the presence of the malaria parasite, Plasmodium, swimming in your bloodstream. The blood sample is placed under a microscope for examination. The lab technician looks for any signs of the parasite. If the parasite is present, it's usually visible within the red blood cells. This test not only confirms the presence of malaria, but also determines the specific type of Plasmodium causing the infection. It's vital to diagnose malaria as early as possible to start the appropriate treatment and prevent complications. It's a quick process, but a crucial one in the fight against this disease. Remember, early detection can significantly increase the chances of a full recovery. After diagnosis, it's time for the right treatment. What can be done if you've been diagnosed with malaria? It's a daunting question that many have faced when dealing with this widespread disease. However, fret not, as science has provided us with several effective treatments to combat malaria. Once a malaria diagnosis is confirmed, treatment can begin immediately. The main course of treatment is anti-malarial medications. The choice of medication depends greatly on the type of Plasmodium parasite that has caused the infection and the severity of the symptoms. It's crucial to remember that these medications are potent and should only be taken under the supervision of a healthcare professional. One of the oldest and most commonly used anti-malarial drugs is chloroquine. It's effective against the Plasmodium vivax parasite, which is prevalent in many parts of the world. However, some strains of malaria have developed resistance to chloroquine, limiting its effectiveness in certain regions. Another widely used medication is quinine. Derived from the bark of the cinchona tree, quinine has been used to treat malaria for centuries. It's often used in combination with other drugs to treat severe malaria cases or those caused by parasites resistant to chloroquine. In recent years, artemisinin-based combination therapies, or ACTs, have become the standard treatment for malaria. These are fast-acting drugs derived from the sweet wormwood plant, and they're usually combined with another longer-lasting drug to enhance effectiveness and reduce the risk of resistance. Now, it's important to note that while these treatments can effectively clear the malaria parasites from your body, they do not provide lasting immunity against the disease. That means if you're bitten by an infected mosquito again, you can get malaria once more. So what's the key takeaway here? Well, as with many things in life, when it comes to malaria, prevention is better than cure. It's far more effective to prevent infection in the first place by taking precautions like using mosquito nets, wearing long-sleeved clothing, and using insect repellent. Remember, prevention is better than cure. How can we prevent malaria? This is a question that we all need to consider seriously. Malaria, a disease that continues to impact millions globally, can be prevented through a combination of simple yet effective measures. The first step in prevention is to understand that mosquitoes are the primary carriers of the malaria parasite. Therefore, controlling the mosquito population and limiting exposure to these insects is crucial. One of the most effective ways to do this is by using mosquito nets, especially during sleeping hours. These nets, often treated with insecticides, provide a physical barrier against mosquitoes, significantly reducing the chance of bites that can lead to infection. Another key preventive measure is the elimination of standing water, which serves as breeding grounds for mosquitoes. This includes water in flower pots, buckets, barrels, and puddles. By ensuring that these areas are drained or covered, we can disrupt the mosquito life cycle and reduce their numbers. Lastly, preventive medication is an essential consideration. especially for those traveling to regions where malaria is prevalent. These medications are designed to prevent the malaria parasite from completing its life cycle in the human body, thereby preventing the disease from developing. With the right knowledge and precautions, malaria can be prevented. By implementing these measures and spreading awareness, we can contribute to the global fight against this potentially deadly disease. Let's all do our part in making our world a safer, healthier place. That's a wrap on our deep dive into malaria. We've navigated through its causes, symptoms, diagnosis methods, and treatments. We've also underscored the importance of preventive measures such as using mosquito nets and eliminating breeding grounds. Remember, awareness and early detection can make a world of difference. Don't forget to subscribe to our channel for more educational content. Thank you for watching.